I mean, it seems like we're getting closer and closer to that date. That date, I think, of May 3rd. So who knows what's going to happen on May 3rd if we're going to be able to get back to business. But I know that a lot of you guys are making strategies for online selling and online education. There's so much that you can do. And I have found that a lot of people are actually really thriving in this situation. Also, just so you know that we do have selfie categories for the skin games, which are getting really, really popular. We have one for skin, and basically what that one is, you just basically do a 4-week case study on yourself and kind of show your safety practice, sanitation practices, kind of demo videos and stuff. If you want to do that, it's free to our community. So something fun to do during the quarantine. We also have one where you could do a before and after for makeup. You could go all glam, or you could go corrective, bridal, whatever. That's super fun. And actually, I have some sponsors out there that are interested in throwing some makeup your way. So give me a buzz if you guys are interested in that. Also in skin too. And then we also have a lash category, which actually isn't doing the lash extensions on yourself. You're actually applying to a strip lash and doing something kind of fancy that way and applying it to yourself. And then finally, there's a waxing category, which I just was outside looking at my legs. Oh my God, I have these straggly hairs that are about 2 inches. I mean, not a lot of them, but anyway, I'm going to be doing a waxing video later. So anyway, I'm going to bring up Alma, who's the director of the lash category, and she's going to introduce our guest today, which you guys should all totally hang out for. She is very, very knowledgeable, all things eyes, and she's a doctor. And anyway, let's have Alma come up, and she can tell you about it. Alma, are you coming up? Alma. There she is.
Hi.
Can I hear you? There you
go. I just want to make sure that we're live. So let me just, when I get back on there, just make sure, because I don't see it on our page, Anyways, hi, everyone. And I hope everybody's doing good. I know, Jennifer, you were talking about the date, right? I can't wait either to get back to that date.
Can you tell us a little bit about this, our
speaker?
Our guest today, yeah.
Yeah. So Dr. Tanya Gill, she actually was the founder of We Love Eyes. She's an optometrist, but she's also, let me show you, has some great products out here. Look at that. Ooh, let me
you have to kind of turn it so ooh. Oh, I love the name, We Love Eyes.
Yeah, and she has really.
So this is all about the health of the eyes, more so than like eyelashes and things like that, right?
Well, she also wears lashes. I'm gonna let her talk about it, why she created this, because I mean I know the story, but I would love for her to just come out there and talk about the story why she created this We Love Eyes. She herself wears lashes. So here she is.
Okay, you guys go to it.
Hi, Debbie. Hi, Alma. Thanks for having me.
Yes, let's check one thing and make sure that we are live. Yeah, I can hear you. Can you hear me?
Okay, great. Yeah, I can hear you. Thanks for having me.
Yes, for sure. So I just kind of see where I pointed. Okay, yeah. I pointed out your products, which I am so in love with, and I reached out to you, God, maybe like 3 years ago now.
Yeah, it was when I first started We Love Eyes, and we connected like that instantly. Exactly. And I think you saw the products and it just kind of struck a chord with you. So yeah, I was so excited to meet you at the trade show.
I know. So this is the eye wash. I do have I forgot to bring the oil, but this is the one that I really would love for you to talk about in a minute. But before we get started, I want you to tell us, I mean, we have a lot of people that know you in in the lash industry and Instagram. We have a lot of followers there. But can you tell us why you got started with We Love Eyes? Because I know you're an optometrist.
Yeah, so I'm an eye doctor, which is super fun and challenging in itself. But I would seriously have patients, and this is way back, this is years ago, 2014, if not earlier, who wore contact lenses. And I remember telling this one patient, okay, if you want your contact lenses to be comfortable, I'm not changing your contact lenses. You just need to actually remove your eye makeup. And of course, I'm in the Berkeley, Oakland area. And she said, fine, Dr. Gill, I'll do that, but I need something. And she had this laundry list of items: vegan, cruelty-free, paraben-free. I need all of these things. I'm not putting anything else on my eyes or body for that matter. And I said, okay, let me get back to you. So I went to Whole Foods looking for that exact eye makeup remover. And to my shock and disbelief, not one existed. So I said, okay, so I'm not going to, challenge accepted. I'm just going to make something. So I did a bunch of research. And I remember as a little girl, I'd sit on the toilet and watch my mom remove her eye makeup with these oils. She's Chinese, and a lot of Asian women use oils to cleanse their face and remove their makeup. And I remember that distinctly, just mesmerized by what she was doing. So I thought about that, and I also thought about the anatomy of the eye, and that's what makes We Love Eyes products different than any other eye product out there. I emphasize cleansing, I emphasize health, but really with the emphasis of anatomy of the eye. So there are 50 eyelid glands called meibomian glands that distribute oil to your tear film. And I wanted an eye makeup remover that was thoughtful and mindful about eyelid glands. Nobody thinks about them because that's what makes contact lenses uncomfortable or comfortable. So I went and made this product, brought it to her. She used it. She's like, oh my God, this stuff is amazing. And so I was making it and giving it out for free for patients for a couple years. Eventually, I couldn't keep up with demand. They're like, oh, can you just sell me a bottle? I was like, sell you a bottle? And so before you knew it, I had to do a label, had to go through insurance, third-party testing. And then before you knew it, I had an official eye makeup remover, this product, if you can see that. Sorry, there's
I
a little
love
bit
that.
of glare. Yeah.
So was that your first product you came out with?
Yes, that's the very first product I came out with. Smash success in my practice. Sorry, I have dogs.
That's fine.
Hang on 1 second. Can you mute me? Hey, puppies, stop. Jeff.
This is how it is when you work out of the house. So
Yeah,
let me ask you a question. So you created this, but I have clients that don't even use don't even have eyelash extensions, and they use this oil because, especially here in California with the Santa Ana winds, your eyes get really itchy. Like my boyfriend loves it. He's really allergic, right? And I'm also like, I get itchy. My eyes get really itchy and dry around here. The We Love Eyes always amazing.
Yeah, and that's the first product, but there's many different products for every type of patient I have. So in comes my patient with the eyelash extension and infection one day, and she sits down and she says, Dr. Gill, you're never going to believe this, but my lash artist gave me an eye infection. And I was thinking, so you're telling me she dipped her hands in bacteria and put it on your eyelids and sent you home and on your way? So that's my biggest pet peeve. People will automatically blame the lash artist. And I said, no, it's because you stopped washing. And I'm sure you got directions, but you ignored them.
Yeah.
So anyways, she said, well, make me some better products. And so this is 2014. So I said, okay, challenge accepted. So that's what I did. So we can walk through. Is your audience primarily lash extension?
Pretty much lashes, yeah.
Pretty much
we do have some people that come in, but pretty much estheticians, bit lashes. But it's good because we have people that are estheticians, and they have their they're just doing skincare, but they have people that come in with lashes.
So you guys, let me ask you a quick question before I go below again. Could you talk a little bit about sanitation in general, Dr. Gill, and also steps that estheticians should take, maybe in, because you were talking about a lot of times it's not the lash artist that is causing the infection, but maybe their lack of knowledge of how they got it or something. It would be great if you could give us some questions, some answers on that.
Yeah, for sure. And so I have a model here. So this is a very clean, healthy eyelid, right? So you see the lashes, and of course, when you're installing extensions, you're attaching it to these little ends of your lashes and making your lashes longer. So this is a healthy eyelid, and this is what everybody should shoot for. Okay. This is also an eyelid that's going to have retention. It's healthy. The follicles are healthy. And back to anatomy, if you have a healthier eyelash follicle, you're going to have healthier, longer retention, and your client is going to think you are amazing and a magician. So it comes down to, if you can keep the follicle healthy, you're going to keep your customer happy. All right, so that was a cute one, the pretty one. This one is what they look like when they come see me. So you can see that some of the lashes have fallen out, but do you see this crusty, gross debris? That is a classic appearance of blepharitis, and
Yeah.
that's when, the disaster starts happening. And you see the dotted area up here? These are meibomian glands. These are the specialized oil glands. If you get too much bacteria, they can get clogged, and these are all clogged glands. So if you looked at the original, clean and beautiful,
Yeah.
right? And then now these are all clogged. It just looks terrible. So when she
So
walks
that
in, she
was
says,
like a little cyst, because sometimes I see clients, they come in and I have to wash their lashes with We Love Eyes, of course.
yeah.
But they have like little white spots. I'm like, where is that coming from?
These are the white spots, and you need to get rid of them. So I have all these tools. So we're going to talk about just sanitation. And the best thing you want to do is, I always say, for my patients, I do it in the chair for them in the office, and then I sell them the kit to go home, because home care is 99.9% of your success. So let's go through. So the first thing you need is hypochlorous spray. Can you see it in the window here? So this is the spray that you were holding up for us right here, this guy. Yeah. So hypochlorous, it's magic. What's great about hypochlorous, it's oil free. I'll show you the tool a little later. It's a no rinse thing, but it gets rid of all of this debris. It gets rid of bacteria, buildup. And what you need to use, and it's funny, I came out with a hypochlorous and my patient says, that's not good enough. I can't get rid of the debris. So this is my in-between eyelash margin cleansing brush. Can you see the tip there?
Yep.
It's kind of pronged, and it's at an angle, so it's easy for my patient or your client to use. So let me put this model down, but you would spray right on the end of this, and then you would hold your eyelid, and then you're actually going to angle and clean this area with this brush, so that when you have your cleansing brush, you're really targeting this debris.
Okay.
You're only touching the eyelid margin. You are never touching where the extension goes. Nothing should ever touch the extension. I don't care. This debris is only at the base of the eyelid, and that's all she needs to clean. No spraying, no cleansing, not even water on the extension. Nothing touches the tips. The tips are diamonds. Mm-hmm. You want to touch and clean this. This is the area that needs all the attention. So this little in-between brush and the hypochlorous cleansing spray is magic. So if she does this once, and if she's super OCD twice a day, she's just going to automatically get better retention, because this hypochlorous gets rid of bacteria.
Doesn't break down the glue or anything.
Pardon?
It doesn't break down the lash
glue. And it does not break down the glue, because it's absolutely oil-free. And if it gets in the eyes, it actually doesn't sting. It's a no-sting formula. It's awesome. I mean, I spray it on my face when I have a pimple. I mean, the stuff is magic. But for eyelash extensions,
can you tell us a little bit about the ingredients? Like, what makes it so good?
So hypochlorous is a traditional cleansing spray that's only been in the eye world. So optometry and ophthalmology, we've been using it for years. It is not a bleach, but it still has the molecule of the chlorine family. So it's ultra cleansing. Even during COVID, you'll hear people say, spray your face, clean yourself with hypochlorous. It's ultra cleansing. But what's great about this hypochlorous, it's pH balanced for eye care. Hypochlorous was actually originally invented, believe it or not, for burn victims to clean their wounds. That's how super cleansing it is.
Oh, wow.
Yeah. Okay. And you can actually, have you tried almost spraying it into your eye?
Yeah, I have. Like, believe it or not, I spray it on my mask, inside my mask before I go out.
Yes. And that's, of course, it's not a treatment for COVID, but yeah, I mean, the cleaner you can be, the better. So I'm going to talk about the second brush, and this is a tool. So if you're actually in your clinic, can you see this up close? One of my patients said, Dr. Gill, can you make me a mini toothbrush?
Oh, nice.
Do you see the little bristles on the toothbrush? Is that clear enough?
Yeah, put your hand, maybe if you could put something.
Okay, good idea.
Black or something. Yeah, a little bit, yeah.
Maybe my phone will be better.
Yeah, perfect. Yeah, let me see.
In there. Yeah, you see the little toothbrush?
Yes,
the little bristles? Mm-hmm. They're tiny, but it's there. It's a mini toothbrush. And so if you actually have, back to sanitation, if you have somebody that comes in with this eyelid and you see those bumps, you can actually take the hypochlorous, you can actually take, better yet, cleansing oil, and you can actually scrub these little dots away.
Okay.
With
And
a
it
little
will not hurt
toothbrush.
the client. Like it's not going to be. It's not
Oh,
going to
no,
be.
no, no. The brush, it's like brushing your teeth, right? But you want to be gentle enough to actually break open this epithelium and break open these glands. You want to do this first with probably the cleansing oil product, which I'll show you here for a deep cleansing.
Okay.
And this is the deep cleanser right here.
Okay.
But if you do this, you see this, right?
Mm-hmm.
By the way, I'm a stickler about refills and new fills. If the patient presents like this, what are you going to do? No refill. No way. Not on my dead body, right? So they're going to get everything removed. They're going to get a super cleaning of these glands with a little toothbrush with the cleansing oil. And then you're going to wash with, we have a foaming cleanser to help rinse off all the oily debris.
I love that.
Right? And then you're going to do a brand new fill. And then you're going to send them home with the hypochlorous spray and the in-between brush for home care.
So you're saying if somebody comes in and they have the blepharitis all build up, you do not want to do a touch-up?
No. And
Okay.
that's
let me ask you too, Dr.
Yes.
Gill. So one of the reasons I don't get actual if you notice, my eyes are, I mean, like people think I'm stoned all the time. I'm like, my eyes are always red. So I'm very, very reactive to mascaras and stuff like that. And is it because of of what you're talking about here, or is it a sanitation thing, or is it just dryness? What would you say?
So for you in particular, I have a lot of people that send me a message online. Oh, my eyes are irritated. I look like I smoke pot all the time, but I don't. What's my issue? I'd have to diagnose you. So it could be you have this problem, this buildup, so you're not getting enough oil in your tears. That's pretty much that's probably the most common diagnosis I do. It's called meibomian gland dysfunction of the specialized oil glands on your eyelid. But having said that, it causes dry eye. So it's all intertwined together. But doing a really good scrub, I mean, I use that little mini brush on my eyelids every other night. Yeah. I mean, it's annoying. It's like flossing your teeth, but it feels so good. The next day, my eyes are white.
So the whole idea of the eye dry syndrome, right? Because you hear that on TV or something.
Dry eye syndrome.
That pretty much has to do with the clog of the pores, right?
Yeah, I mean, in my clinic, I would say 90% of my cases have some form of this. This obviously is pretty severe. This is when she walks in my exam room and says, I can't do anything. My lashes are falling out. This is severe. But MGD can be mild. It can be moderate. It can also look like this. But you can start having symptoms absolutely when it's mild. And the thing is, if it's mild, it's going to get moderate, and then your lashes start falling out. And that's when it's all preventable. But home care is really 99.9% of your client's happiness.
Yeah, most of our trainers, when they say that, when you have blepharitis, is you got to treat the blepharitis first before you actually do the extension. So I'm glad you brought that up, because it goes to what some of the trainers are saying, that, treat it first. And it's great because you can sell the kit. The kit's amazing. You can sell the oil. I don't have the oil with me right here, but you can sell the oil, this too, And it's not only, sometimes, when your eyes, you have the lashes and your eyes get a little itchy, or it's a little bit more humid out there also, spraying that, it just gives you that really nice, relief.
Yeah, and a lot of the lash artists, the good lash artists, what they do is when they actually do the scrub, so there's a line item with the toothbrush and the scrub. So if she walks in and she has any form of blepharitis, mild, moderate, severe, and it's going to be a lot of your cases in the beginning, especially if they're new patients, you want to have a line item on your sheet, full install, refill, and then a line item, deep cleansing, $20, $25, however much you want to charge. You're going to do that procedure, but you're also going to add $20 onto the fee slip before they check out, because they have something medical that needs attention, or else they're going to have failure. So I think that's an added value to
it's kind of going to the dentist. You go to the dentist, get your teeth cleaned, but then if you want to get that deep cleansing, it's more.
It's not free. You got to pay for it. Yeah.
Because they're coming to us, we're cleaning their lashes, but they're not taken care of. We're giving them. It's so funny that you say that, because we tell the clients, clean your lashes.
But how? And what's great about when you do it in the chair seat for them, you're educating them on how you want them to clean it,
Mhm.
and then you're also sending them with a care package home.
Yeah, no, I love it. It's like when my client lives. The only thing is, yeah, my clients leave. They leave with the cleanser. They always have the cleanser. The oil. I still have oils, you know, and I do sell it to some clients. But I'm glad that you're here because, I was always afraid it was going to break down the glue with the oil.
It will. So everybody, makeup remover oil, cleansing oil. If the extensions are in, do not touch my oils. It's really meant for people without extension. You want to concentrate on the hypochlorous cleansing spray. That's going to change everything for you. And we have a tea tree foaming cleanser, and back to tea tree oil and eye glands. Why tea tree oil? So everybody's like, tea tree oil is scary. Yeah, it is if you put it on your eyes, but in the right concentration, tea tree oil actually targets, has MMP9 properties. It actually cleans all of these glands, especially with that little toothbrush. So tea tree oil is magical when it comes to lash care, optometry. We've been doing it for many years, and there's many research articles, even from National Institute of Health on it. Tea tree oil in the right concentration is magical. And I do have a surprise because of COVID. Things have been a little like delayed, but many requests, Alma included, we are going to be launching it 100% oil-free foaming cleanser. Nobody knows about this except for you guys.
Wow.
But it is called tea tree water. So 100% oil-free. So if you combine this baby with, we have a brush. We also have an eyelid margin cleansing brush, which we can talk about. These two together can also give you pretty complete lash care. So you put a little bit of foaming cleanser on the tip of this brush. And everything's a personal preference. Some patients, they love this brush. Some patients want the in-between. But this can potentially do both. Sorry, okay. Let's do it from, it just cleans this area and has a little tiered component to it. But
I'm super excited to try the other one. I mean, I love all your products. I'm super excited to try the, what's that one called?
This one launches in a few weeks. It's been a little bit delayed, but this thing is going to change everything. Yeah, because it's 100% oil-free, so you don't have to worry about lash retention because there is tea tree oil in my original, although the concentration is very low. This is going to be a far superior product, and it's pink.
Yay. So let me ask you a question. Because, even though I do have clients that come in and they have like their eyes are itchy, what I personally do, and I have them laying there and I wash their lashes, but then I do put a little bit of the oil and then I remove it before I apply the lashes, and they just let it sit there for like a few seconds, and then it feels a lot. And I tell my clients, put it on your tips of your index fingers and just tap on it right here. And then let it wait for like 10 minutes and then go back, especially doing their dry skin, like in this area.
Oh, for sure. Yeah, I mean, as long as you are the lash technician and educating exactly and showing the client exactly how, because there's going to be some ladies that want to still wear eyeliner and eyeshadow with extensions. How do you remove it? And using the oil is the best way. So I have some patients that will put a drop of the makeup remover oil on a Q-tip, one of those cosmetic Q-tips, and carefully, painstakingly remove their eyeliner every night.
Yes, like this. And exactly, I'm so glad because exactly what I tell my clients is just take a little bit and just kind of, remove. And then go back with your, and especially because the eyes get like, I have a lot of clients here, their eyes, because of the Savannah winds, their eyes get a little dry or itchy. And I tell them, do this with the Q-tip also, and then just remove it and then do the We Love Eyes cleanser.
Yeah, and the makeup remover oil, not to brag, but it contains the beautiful grapeseed oil, which is actually very helpful for wrinkles too. So you are kind of killing two birds with one stone there. So thank you for that.
Yeah. So, okay, so then you got involved with, you saw people coming in, you saw how dirty your lashes were, you created We Love Eyes, and you have some other products, I believe.
I do. We have a whole assortment of products. So I really want to concentrate on cleansing and then tools for cleansing. We also have this guy. This is a nighttime PM eyelid butter. So I essentially designed this or formulated this for just my personal use. It was so well received. I ended up bringing it to market. So, I'm in my 40s. And so when I would wake up in the morning, I just felt like I had fine lines and wrinkles. And I did some research, and the skin on your eyelid is 4 times thinner than the rest of the skin on your face. So what's actually happening when you're sleeping is your eyelid skin is dehydrating very quickly. So all of these eye creams at night, they concentrate on like hydrating, when in fact eye cream should actually, back to anatomy, eye cream should actually be preventing dehydration. And that's what this does. This is super thick, sticky butter. That's why it's called PM eyelid butter. But you put it on, you look like, you're playing for Team Unicorn for football, but you'll see a glitter. You can see it's kind of shiny.
Yeah,
it's beautiful when you put it on.
So can you put it on? Can you put on your serum and then put that over it? Like, can you put on your
yeah. I would actually put this on first, but I own the company, so I put a lot on. But you just need a little bit, and then you just go to bed. You wake up, it's completely
closer to the light. I like it. How can you wear it during the day too?
I wouldn't. It interferes with makeup use. It's really meant for nighttime, because I'm also coming out with an AM version that's magical too. But nighttime, you really want to concentrate on preventing dehydration. And then to close the loop, AM, you want to hydrate and add. I'm top secret. I'm giving away all these things, but I made an eye cream with a vegan source of retinol. Retinol. Back to the anatomy of the eye, retinol actually damages your oil glands in your eyes. So the oil glands in the eyes are actually, do you see how long they are? They're actually elongated. Do you see that?
Yeah.
So what's interesting is when you apply, let me use the other model. So here's a meibomian gland. It's this thing in beige right there. It's pretty long. So when you actually apply creams and all of these other things to the eyelid, what happens is it actually migrates to the epithelium and gets into contact with all of the glands in your eyelid. And what happens, it damages your eyelid. So if you've been using retinol on your face, because the eyelid glands are so long, it'll migrate up into the epithelium, destroy your meibomian gland. Those are your oil glands. You need it for contacts to see comfortably. Your eyes are red. So I see a lot of retinol damage. So my AM eyelid gel also has a vegan version of retinol, so it's super safe. So anyways, back to this. This stuff is great to use at night.
I can't wait to try.
Yeah, to do both. And I'm 47 years old, but I've been using both for about a couple years. And I think I'm doing pretty good. No makeup on.
Nice. Yeah, you look great. You look great. Yeah. So one more thing with your packaging. I have a packaging back here. It's all I believe it's all recycled, correct?
Yes, it's craft boxing. Just throw it in the recycle bin. It's brown craft box, super simple. And to be honest, when I started with Levi's, I had no money, so all I could afford was the craft box with one color print, and so I just kind of kept it that way.
It actually looks so cute, and you also have these little things that I love, because it's like you have these little things that you put on. Like I have them for my display. Like this is one of them, but I don't have the other one that says, "Friends don't let friends sleep with makeup on."
Yeah, I like to have fun with it. And I think on the eye makeup remover, I wrote this years ago. What does it say? It's something like, it's only a walk of shame if you forgot to remove your eye makeup.
That's so cute. Yeah. So, let me see if I have any questions out here for anybody that would like to ask. Yeah, because one of the things too is, can you tell us, I have some clients, I tell them to clean their lashes. I sell them the products to go home with and little brushes too. But sometimes they have a little like cyst. Is that called a cyst? There's one called a cyst and one called something else closer to the eyelid.
Yeah, there's one called a hordeolum and there's one called a chalazion. So the hordeolum will be bacteria based, and that's, if they were extensions, they probably had something to do with bacteria. You want to be extra careful and do a super cleaning with that client for sure. But if they have what you call a cyst or a bump or a pimple, like a pimple, sometimes you have one that's infected and sometimes not. It's exactly the same anatomy when it comes to a pimple.
So when you have a pimple, can you use hypochlorous?
Yes. Like I mentioned earlier, hypochlorous is amazing. When I actually have a pimple on like my face or something, I'll just spray it. But yes, you want to use that. That is the
Okay,
ideal
okay, okay.
product.
So like so I have a little like cyst right here. I'm gonna spray it on me, it's gonna go in my eye. Is that okay?
Do you have eyelash extensions on right now?
I have a strip lash.
Oh, okay. If you have strip lashes, you can spray. That's no problem. But if you have extensions in, you really want to always utilize a tool to apply any product. I don't want you spraying hypochlorous over your eyelash extension. Even water can loosen that bond. It's the weight of the water, the weight of any spray.
Yeah.
So if you have extensions, the tools are really your friend. You want to use the tools.
Okay, great. Well, guys, I mean, we are so grateful to have you here, and I know.
Feels good.
Yeah. So we're so grateful.
Just so you know, Helen from the UK would like to know if you stock in the UK.
We would love to stock in the UK. We've been trying to, but for now, you can actually order wholesale and have it shipped over to the UK. And I think shipping is like $19. It's relatively inexpensive when you order.
Are you looking for distributors?
We've been interviewed by a few, and these things are very expensive. So We Love Ice needs to make more money. We're just a scrappy startup. So once we make more money, we'll for sure be more or less into the UK, but that might be next year.
Well, you know what would be really nice right now? I don't know if you know this, Dr. Tanya Gill, is is it Gill or Jill?
It's Gill, like
That's
the fish
right,
part. Yeah, not very
Yeah.
sexy.
Yeah. We have a selfie category. And one of the things that would be really nice, and one of the things we are working on right now, is getting a lot of videos about feedback on what they do for sanitation, cleansing tips, and things like that. It would be really nice if some of these people in the selfie category would like to possibly use your products to show their sanitation skills. What do you think about that, Alma?
I think it'd be great. Yeah, because they're out there showing the spray. But you know what? This is great because it's not just for lashes. I mean, you have clients that come in and they have they use. I know that when I used to work in cosmetics, I would have clients come in and they were like their lashes. I mean, their eyes were just because they were putting too much eye makeup. And a lot of times eye makeup is so concentrated, right?
Yes.
Exactly.
Yeah.
Exactly. And then this is before the extensions. They were just putting so much, like we do it like right here and right here. So I was taught to always put the eye makeup like right here and then up here because it will always travel down and this will travel up. I don't know if that's correct, but that's how I was trained, with the eye makeup. But we have people that we take these makeup and they were just like all over.
Yeah, that's actually a really interesting point. And believe it or not, people never understood why that was a recommendation. It's because the meibomian glands, the elongated oil glands of the eye, are easily damaged, and retinol was in a lot of the products. So It was it's like the elephant in the room. Nobody ever talks about it. Retinol products are the #1 eye products sold in the world. And
yeah, everybody wants to work on this, right?
There are peer-reviewed studies how it is damaging to oil glands. It's kind of amazing. But as an eye doctor, I plan on changing that. No more retinol, for sure.
Good to know.
And if you think about it, just one last point, how is an eyelid that looks like this supposed to retain eyelash extensions, right?
Exactly.
It doesn't. You need this guy. Yeah, this is our goal.
I love how you made the little
the visual.
Okay. Well, guys, if you have any other questions, Jennifer, is there anything you want to add?
What about my discount code, Alma?
Oh, yeah. You can do a discount code. Yeah.
I want everybody to try. Yes.
What's the code?
I told you yesterday. Did you forget?
I think so.
So you can go to weloveeyes.com and get 50% off anything in the store, so you can try for yourself. And this is just the retail shops. You don't even have to enter wholesale, nothing, but 50% off everything with Skin Games 50.
Skin Games 50. Yeah, Jennifer will put it on there on that. And then you can follow her on Instagram, or you can also go to her website, like she was saying. We'll put it out there on the comments. We Love Eyes. And then I think it's Instagram's We Love Eyes XO, correct?
For Instagram, it's We Love Eyes XO, yeah. And the website is just weloveeyes.com.
Okay.
Yes.
And the code is the Skin Games 50.
Skin Games 50, no the.
Well, thank you so much for
You're
being here.
welcome. Thanks for having me.
Yes, there's a lot very informative stuff here. If anybody's interested, Helen from UK, go ahead, go to her website, and right now you're getting a discount for that. And I guess you said shipping's not that much to the UK right now.
I mean, I think it's like 19 if you order like 40 pieces. That's for wholesale, but it's like $8, I think, $8.
Yeah. And I sell these. Okay, so I sell them wholesale. I mean, I sell them for $20. My clients, any new client I have, I normally sell this in the oil. I don't have the oil with me right now, but I sell this with the oil. They leave, and now I'm just adding
hypochlorous.
Hypochlorous, a new product. Where we go? It's backwards. So yeah, I'm adding new
product.
And
another top secret thing next week or in a few days because of COVID, we're actually a lot of the online like optometry and ophthalmology and lash artists, they've started their own online stores out of a necessity. Mm-hmm. So we're going to be launching something wholesale. I think it's on the 24th or 27th. But basically, you're going to get 75% off everything. So imagine buying something for $5, being able to sell it for $20, buying something for $10, being able to sell it for $40 to really help all of my wholesale customers with cost of goods until the stay-in-place order is completed.
Okay, perfect. That's great. Yeah, that's really great. So guys, remember that. So when is that going to come on?
Supposedly the 24th, but 24th, 25th, 27th, we'll send an email blast out, and I'll let you know too, so you can make an announcement.
Okay.
But that will really help if you want to order wholesale quantities and really do well with cost of goods.
And guys, so keep in touch. We might be, we're looking into it. We're not quite sure yet, but we're looking into it. Maybe having you as a speaker at the Skin Games. And if not,
that would be so fun.
Yeah, if not this year, definitely next year. She's gonna talk about all about eyes. We'll figure something out, but we would love to have her for the Skin Games as one of our speakers for you guys to come and learn about the eye anatomy. And I love that she has all these little props because you can really visualize what she's talking about. When you go to trainers and they tell you about the eyes and the eye glands and you see pictures, it's so different when you're hearing it from a doctor. So thank you again.
Thanks for having me.
Yes, stay safe and healthy, and we'll talk soon.
Bye, everyone. Thank you.
Bye.